You've been taking your cholesterol medication for years. It's part of your morning ritual, right next to your multivitamin and your coffee. You trust that it's doing its job, keeping your arteries clear, protecting your heart, and giving you that extra layer of security. But what if I told you that one of the most common things in your kitchen, something you probably had for breakfast today, might be actively canceling out your medication, or worse, turning it into a silent source of muscle pain and fatigue? Most people over 60 assume that if a pill is prescribed by a doctor, it's foolproof. But here's the reality. Your body at 65 is not the same biological machine it was at 40. Your liver processes compounds differently. Your kidneys clear substances at a different pace. And the way your gut absorbs medicine has changed. When you mix your statin or other cholesterol-lowering drugs with the wrong common household item, you aren't just losing a little bit of effectiveness. You are often creating a metabolic bottleneck. You're forcing your liver to choose between processing your life-saving medication or processing that healthy habit you added to your routine. In this video, I'm going to break down 5 of the most common things that millions of seniors mix with their cholesterol meds without a second thought. I'm not talking about rare, exotic drug interactions you'd only find in a medical textbook. I'm talking about things you likely have on your counter right now. I'll show you why these specific interactions are the secret culprits behind that unexplained heavy legs feeling, that constant fatigue you can't shake, and why your last blood test didn't show the improvement you and your doctor were expecting. We're going to cover the science, we're going to cover the risks, and most importantly, I'm going to give you a clear, actionable guide on how to safely manage your routine so you can get the full protection you're paying for. But before we dive into the first item, a common breakfast staple that you might want to look at twice, we need to talk about why your medication is actually doing more heavy lifting than you realize. When I talk to my patients, there's a recurring theme I hear in the office. It usually starts with, "Doctor, I'm doing everything right. I'm taking the pill every single day. I'm watching my salt, and I'm walking. Why are my numbers still creeping up?" As a physician, I've spent years looking at the data, but I've also spent years looking at the lifestyle. We often treat the medication as a standalone event, a box to be checked off in the morning. But your body doesn't see it that way. It sees a constant, complex chemistry experiment. Every time you swallow a tablet, you are introducing a compound that must be transported, metabolized, and eventually cleared. Think of your liver as the main engine room of your body. It has a specific set of enzymes, particularly the CYP450 system, which is responsible for breaking down most drugs. When you introduce another substance, whether it's a food, a common herbal supplement, or another over-the-counter medication, you might be unknowingly clogging that engine room. You aren't just taking 2 things at once. You are forcing your body to juggle 2 processes at the same time. If they compete for the same pathway, one of them loses. Usually, it's the medication that gets sidelined, or worse, it stays in your system at levels that were never intended. Which is exactly where side effects like muscle weakness and joint pain start to bloom. Quick favor before we go further. Drop your city, state, or country in the comments. When I see where people are watching from, it helps me tailor the advice for what you're dealing with where you live. I read everyone. It helps me know who is sitting across from me in this digital office. Now, stay with me, because what I'm about to show you regarding the healthy items in your pantry is going to change the way you set up your medicine cabinet forever. This isn't about blaming you, it's about giving you the tools to stop sabotaging your own hard work. I want you to meet one of my long-term patients. Let's call him Arthur. Arthur is 68, a retired architect who takes pride in his disciplined health routine. He was on a standard statin for years, and for a long time his numbers were rock solid. But about 8 months ago, Arthur came to see me with a complaint that's far too common. "Doc, my legs feel like lead. I wake up, and it takes me 10 minutes just to get moving. I thought it was just age catching up, but this feels different. It feels heavy." He wasn't wrong. He was describing classic myalgia, or muscle pain, which can be a side effect of cholesterol medication. But he'd been on this dose for years without an issue. So we started auditing his life. We looked at his diet, his exercise, and his sleep. Everything was the same as it had been for a decade. Then, I asked him to walk me through his morning routine from start to finish. "Well," he said, I started taking this natural liver support tea every morning with my meds. It's supposed to be great for detoxification. I figured I'm getting older. My liver could use a boost. That was the aha moment. Arthur thought he was helping his liver. In reality, that herbal blend was flooding his system with compounds that triggered his liver's enzyme production in a way that directly interfered with how his statin was being processed. It essentially turned his liver support into a medication blocker. His body was trying to clear both at once, and the medication, the one meant to protect his heart, was being spiked to levels his body couldn't handle. That heavy leg feeling wasn't just age, it was a physical manifestation of a chemical collision. We stopped the tea, kept the medicine, and within 3 weeks, his energy returned. This happens more often than you think. You aren't just a person taking a pill, you are a biological landscape. When you add a variable, a new drink, a natural supplement, or even a basic over-the-counter painkiller, you are changing the terrain. For Arthur, it was a detox tea. For you, it might be something you consider completely harmless, like a morning glass of juice or a specific type of vitamin. The story matters because it shows us that the most dangerous interactions are the ones that sound healthy. We are conditioned to think that if it's natural, it's safe. But in the world of pharmacology, natural just means chemically active. And if that activity happens in the same pathway as your medication, you're playing a game of chance with your own recovery. Let's get into the specifics. The first item on our list is one that many of you have heard of, but perhaps haven't taken seriously enough. I'm talking about grapefruit. Now, I know what you're thinking. Doctor, it's just a fruit. It's vitamin C, it's refreshing, it's healthy. And you are right. In a vacuum, grapefruit is a powerhouse of nutrients. But for someone on cholesterol medication, it is a chemical disruptor of the highest order. Grapefruit contains compounds called furanocoumarins. These aren't just fiber and sugar, they are inhibitors. They specifically inhibit an enzyme in your small intestine that is responsible for breaking down your medication before it even enters your bloodstream. When you eat grapefruit or drink its juice, you effectively disable the gatekeeper that controls how much of your medication reaches your circulation. This means a single pill can suddenly behave like 3 or 4 pills. It's like turning the volume on your radio from a comfortable level to a level that blows out the speakers. This is how you end up with sudden, unexplained muscle aches or liver enzyme spikes that have nothing to do with your dosage and everything to do with your breakfast. The second trap is the natural supplement category, specifically St. John's Wort. Many seniors turn to this for mood support or to help with the winter blues. It is widely sold and seems benign. However, St. John's Wort is essentially a hyperactivator of your liver's metabolic pathways. Instead of slowing things down like grapefruit, it accelerates them. It tells your liver to work overtime, dumping your medication out of your system before it has a chance to work. If you take your cholesterol pill alongside St. John's Wort, you might be essentially flushing that medicine right down the drain. You're paying for the prescription, you're taking the time to swallow it, but the St. John's Wort is making sure it never actually stays in your blood long enough to clear those arteries. It's a classic case of what we call pharmacokinetic interference. It isn't just about the drugs you are prescribed. It is about the entire chemical profile of what you ingest every single day. If you are taking either of these, the first step isn't panic. It is a conversation with your pharmacist or doctor. But for now, just know that natural is not a synonym for inert. These substances have effects, and those effects can easily override your physician's carefully calculated treatment plan. You wouldn't add a mystery chemical to your car's engine, so why would you treat your liver, your most important metabolic engine, with anything less than precision? I want you to pause for a second. Put the phone down or look away from the screen, and just listen to me. I see so many people get overwhelmed by these lists. You might be sitting there thinking, great, now I can't eat fruit. I can't take my supplements. I'm just going to stop taking my pills altogether. Stop. Do not do that. That is the single most dangerous reaction you could have. Stopping your medication without a doctor's guidance is not taking control. It is inviting a cardiac event. The goal here isn't to make you afraid of your dinner plate or your medicine cabinet. It's to give you the information you need to have a better, more honest conversation with your healthcare provider. Most seniors suffer from clinical blind spots. You have a cardiologist for your heart, a GP for your general health, and maybe a specialist for your joints. But rarely do all three of those people sit in the same room and look at your entire list of supplements, foods, and drugs at the exact same time. You are the only person who is present for every single one of those appointments. You are the common thread. When you feel off, when that brain fog creeps in or the aches start, you don't need to be your own doctor. You just need to be an informed patient. You need to be the one who asks, "Hey, I take this supplement every morning. Could it be interacting with my statin?" Don't let the fear of a silly question stop you from protecting your health. Your doctor wants to know. They would much rather spend 2 minutes adjusting your timing or your dose than spend 2 hours treating an emergency that could have been prevented. We are going to continue with the next set of risks, but keep this in mind. You are the captain of this ship. You just need the right map. We've talked about grapefruit and herbal mood boosters, but the danger often hides in the most mundane aisle of the pharmacy, the over-the-counter section. The third item you need to be wary of is niacin, or vitamin B3. Many people, especially those who are hesitant about prescription medications, decide to add a little extra by taking high-dose niacin to help manage their cholesterol naturally. Here is the problem. When you combine high-dose niacin with a statin, you aren't just doubling up on cholesterol management. You are significantly increasing the risk of muscle toxicity. The two substances together can stress the muscle tissue in a way that neither does alone. It's not just a minor interaction, it's a cumulative inflammatory stressor on your body's largest systems. Fourth on our list is common over-the-counter painkillers, specifically those containing certain anti-inflammatory compounds. If you are regularly taking something for chronic joint pain, you might be surprised to learn that these can interfere with how your body metabolizes cholesterol drugs. Some of these medications can affect kidney function. Since your kidneys are responsible for clearing the byproducts of your medication, anything that puts an extra load on them can keep your drug levels in your blood higher than they should be, leading to that persistent, nagging fatigue. Finally, the fifth item is high-dose red yeast rice. This is perhaps the most insidious trap of all because it is marketed as a natural alternative to statins. The reality, which many don't realize, is that red yeast rice is a statin. It contains naturally occurring monocolins which are chemically nearly identical to the prescription statin you are already taking. By taking both, you are effectively double dosing without your doctor knowing. You are putting yourself on two different medications, one regulated and one unregulated, which is the absolute fastest way to trigger severe muscle pain, liver enzyme elevation, and potential systemic damage. This isn't about shaming you for wanting natural options. It's about recognizing that natural is still chemistry. You are introducing potent molecules into your system, and you need to treat them with the same level of respect and caution that you would for any prescription drug. If you are taking any of these, write them down today. Don't rely on your memory. Take that list to your next visit and show it to your doctor. It could be the single most important thing you do for your heart health this year. It is easy to think that these interactions are just theoretical, that they only happen in a lab or in very rare cases. But the clinical evidence tells a much more sobering story. A critical review published in the Journal of Clinical Pharmacy and Therapeutics highlighted the widespread nature of drug supplement interactions among elderly populations. The study found that nearly 60% of older adults are taking at least one dietary supplement, and a staggering number of those individuals are on medications that have documented high-risk interactions with those exact supplements. When researchers examined patients specifically on statin therapy, they discovered that the co-administration of certain herbal products, including those used for detox or cholesterol support, resulted in a statistically significant increase in the incidence of statin-associated muscle symptoms, or SAMS. In some cases, the interaction didn't just cause pain, it led to measurable elevations in creatine kinase, a marker that indicates your muscle tissue is actually under attack. Furthermore, the Mayo Clinic proceedings have repeatedly documented that the interaction between grapefruit juice and specific cardiovascular medications is not just a mild issue. It can lead to plasma drug concentrations that are several times higher than the therapeutic range. What this means in plain English is that your body is being flooded with more medicine than it can process. This isn't just about feeling a little tired. It is about forcing your organs to work in a state of constant, unnecessary strain. The takeaway from this research is clear. The hidden danger is not in the medication itself. It is in the combination of modern, highly effective pharmaceutical therapy with substances that were never intended to interact with it. The clinical data confirms that these aren't just interactions. They are preventable risks. When you look at the studies, you realize that a huge portion of the side effects people blame on their old age are actually just the body signaling that it is being overwhelmed by a chemical overload. You have the power to stop this by simply understanding the science, and more importantly, by being honest with your medical team about everything you put into your body. So, how do we turn this around? You don't need to become a biochemist, and you certainly don't need to throw away every supplement you own. You just need a system. I call it the Clean Cabinet Protocol, and it's how I advise my patients to regain control. First, the total audit. This weekend, I want you to take every single thing out of your medicine cabinet and your kitchen pantry that you ingest for your health. Everything. The prescription bottles, the multivitamins, the natural herbal teas, the pain relievers, and even the fiber powders. Lay them out on your kitchen table. Now, create 2 piles. Pile 1 is your doctor-prescribed medication. Pile 2 is everything else. Second, the documentation phase. Take that second pile, the everything else pile, and make a simple list. Don't worry about the scientific names. Just write down the product name and why you take it. Once you have that list, you are going to call your pharmacist. Yes, your pharmacist is often the most accessible expert on these specific interactions. Ask them, I am on your medication name. Are any of the things on this list known to interfere with how my body processes it? It is a simple, direct, and powerful question. Third, the timing strategy. Sometimes the interaction isn't about what you take, but when you take it. For some supplements, a gap of 4 to 6 hours is all it takes to prevent a direct collision in your liver. Your doctor can help you map out a schedule that keeps your medicine effective while still allowing you to take your supplements safely. Finally, stop searching for natural alternatives to your prescriptions online. If you are unhappy with your current medication, or if you feel the side effects are too much, tell your doctor. Don't go rogue and try to replace them with red yeast rice or other supplements. There are dozens of different cholesterol-lowering medications today. If one doesn't work for your body, there is almost certainly another one that will. You don't have to suffer and you don't have to guess. You just have to be willing to advocate for your own biology. Your heart is worth the conversation, and your future self will thank you for the 2 minutes it takes to get this right. We've covered a lot of ground today, but if you take only one thing away from this video, let it be this. Your health is not a collection of separate, disconnected decisions. It is one continuous, integrated process. When you take your medication, you are participating in a sophisticated biological partnership between science and your own body. By simply being mindful of what you mix into that routine, you aren't just preventing side effects. You are ensuring your treatment actually has the chance to do what it was prescribed to do. Keep you active, keep you strong, and keep you independent. You've already taken the most important step by showing up and asking these questions. Now, I want to hear from you. Which of these 5 items surprised you the most? Drop a comment below and let me know. Is it something you've been taking every single morning? Your answer helps me understand what's happening in homes across the country, so I can keep bringing you the most relevant, life-saving information. If you found this breakdown helpful, please subscribe and tap that notification bell. I'm here every week with simple, practical, doctor-backed guidance to help you navigate your health with confidence. And before you head out, check out this next video on your screen. It dives into another hidden health risk that most people over 60 miss until it's too late. I'll see you over there. Stay well.